As mentioned, I'm Ivy Elkins, and I'm a patient advocate who has been living with stage 4 lung cancer for almost 10 years. I'm very honored to be part of the Targeted Therapies Forum and talk with you today about the patient experience and the importance of advocacy in lung cancer. I'll start by telling you a little bit about myself. I live in Evanston, Illinois, just north of downtown Chicago. I've been married for 27 years and have two sons, currently 20 and 22 years old. When I was diagnosed with stage 4 lung cancer in December 2013, my boys were 10 and 13 years old. The first picture up on the screen was taken just about 1 month prior to my diagnosis. In the middle of 2013, I started having some pain in the left side of my neck and difficulty straightening my elbow. I went to my primary care physician, and he diagnosed me as having an overuse injury, probably due to my brand new iPad and an addiction I had developed to Candy Crush. I had an x-ray of my elbow, which was clear, and an MRI of my neck, which showed just mildly degenerating discs, consistent with my age of 47 at the time. My doctor then recommended that I go to physical therapy. So over the next 6 months, I visited two different physical therapists, two different orthopedists, a rheumatologist, and tried numerous exercises and cortisone shots for my elbow. It just didn't respond to normal treatment and kept getting worse. So finally, my second orthopedist ordered an MRI of my elbow, and the MRI showed a mass on the bone, which was impacting the joint. I then visited an orthopedic oncologist who took one look at me, said he was 95% sure the mass was benign, and scheduled a biopsy to double check. Unfortunately, the biopsy results come back and it wasn't benign. It was adenocarcinoma, which I then learned which was a type of cancer that doesn't originate in the bone. I had a PET scan, and it turned out that the origin of the cancer was a tumor in my right lung that had spread to my bones, areas in my elbow, neck, ribs, and pelvis. And a subsequent brain MRI showed that I also had 8 small lesions in my brain. I can't tell you how much I was shocked and devastated. I had no idea that I could even get lung cancer. It wasn't on my radar screen. I didn't have any of the traditional side effects that I associated with lung cancer, such as coughing, wheezing, shortness of breath, or anything like that. I didn't know then what I know now, which is that anyone with lungs can get lung cancer. And I also didn't know that not all lung cancer is the same and is not treated the same. Fortunately, I found a fantastic thoracic oncologist. I'm pictured up there with her, Dr. Josie Patel. And I had biomarker testing and found out that my lung cancer is driven by a mutation in an EGFR gene. I've been treated with oral targeted therapy these past almost 10 years. My first medication worked for close to 3 years, and very soon after I started treatment, my brain lesions disappeared, bone healed, and grew back in my neck, elbow, and other areas, and the main mass in my lung shrank significantly. In 2016, I had some progression in my original lung tumor, so I had repeat biomarker testing and began a new targeted therapy for a secondary mutation called T790M that I had developed. I was fortunate to have further shrinkage in my original tumor. In early 2020, I had a PET scan that showed the only area of identifiable cancer I still had in my body was the original primary tumor in my upper right lung. So I had a lobectomy to remove my upper right lobe. I was considered NED, which means having no evidence of disease, for a lovely 2.5 years. But last summer, unfortunately, cancer started growing again in my lungs, and I'm now on a combination therapy. I take two different kinds of targeted therapy pills for the BRAF fusion I developed, along with my original EGFR mutation. So, why am I telling you my whole story? I'm telling you my story for a few reasons. I'm guessing some of you might identify with parts of my patient journey, and I want you to recognize that you are most definitely not alone. I also want to underline the importance of research. I'm only alive today as a result of recent developments over the past 5 to 10 years in molecular testing and targeted therapies. I consider my relationship with my oncologist to be a partnership, and we work together to make the best decisions possible for my treatment at any given time. I've been incredibly fortunate to see those two little boys in that first picture up on your screen grow up. One just graduated from college, as a matter of fact, last month, and the other will be entering his junior year in college in the fall. I started to get involved in patient advocacy when I learned about the Longevity Foundation's work from a friend I met soon after my diagnosis. Some of you may know her, super advocate and patient Jill Feldman. I found it astounding how little I knew about lung cancer before being diagnosed and felt that it was important to me to share my experiences with others. It took me a little while post-diagnosis to feel ready, but once I was, I began to meet others in the lung cancer community through attending local longevity events and later by traveling to the annual Longevity Hope Summit for patients and caregivers in Washington, D.C. I started telling my story, fundraising, and supporting other patients. I found that I wanted to learn more about the science of lung cancer and keep informed about research and development efforts. So I started reading journal articles and attending conferences like ASCO, which is the American Society of Clinical Oncology, which is held in my hometown of Chicago. Now, my background is definitely not in science. I have an undergrad degree in English and an MBA in finance. However, as I started to learn more about research, I realized that this was the area where I wanted to focus my advocacy efforts. I knew I was alive because of research, and I wanted to share my perspective in order to help scientists better meet the needs of patients like myself. Now, let me back up just a little bit and talk about what it means to be an advocate. As I mentioned before, it took me a little time to feel ready to go out, meet others living with lung cancer, and share my story and perspectives publicly. I had to get used to being a patient before I could become an advocate. As a patient, I started to learn about my disease, but focused mainly on myself and my treatment. I felt very emotional about my diagnosis, which is completely normal, and I couldn't really separate these emotions from any decisions I made. I couldn't even talk about my diagnosis without crying. I was really still grieving the difference between what I had expected to be my life and my sudden diagnosis with stage 4 lung cancer. However, as I started getting more involved in gathering knowledge, I realized how much hope there is today for those of us living with lung cancer. There has been an explosion of new treatments for all stages of diagnoses, and there is so much exciting and promising research and developments on the horizon. I wanted to be part of this. As I applied more, as I developed more in-depth knowledge about lung cancer, I began applying for advocacy programs. I'll give you a few examples a little later that can get me started in focusing on influencing research and representing the greater lung cancer community. Each one of my advocacy activities has built on the others and given me increasing amounts of visibility and credibility. I didn't become an involved advocate overnight, and I still do a ton of learning along the way. I'd like to make sure everyone knows that there are many different ways to be a lung cancer advocate. If this is something that interests you, it's important to find the way that gives you energy rather than drains you. You should advocate in a way that you enjoy, that uses your strengths, and that fulfills you. There are really no requirements in advocacy. You can do as much or as little as is possible for you, given your other priorities and needs in life. Many people advocate for overall lung cancer awareness and education. As I mentioned earlier, I, like many others, didn't even have lung cancer on my radar screen when I was diagnosed. There's a huge need to educate the public that anyone with lungs can get lung cancer. There are a lot of ways to do this, including sharing your story, participating in Lung Cancer Awareness Month activities in November, and becoming part of the White Ribbon Project. You'll see a picture of a group of us on this slide holding giant white ribbons. And to learn more about the White Ribbon Project, you can check out their website, which is www.thewhiteribonproject.org. You can read about how anyone can be an advocate by ordering a white ribbon, they're free, and displaying or sharing it. Others like to support fellow patients and caregivers. This is very important because no one should feel alone with a diagnosis of lung cancer. Longevity has a fantastic program called Lifeline Support, where a patient or caregiver can be matched with someone similar to them for direct one on one support and assistance. There are other organizations that have similar programs, and this support can be in person or virtual, depending on your preferences. Fundraising is another way that many patients and caregivers show support for. I'm sorry, I lost my place. Fundraising is another way that many patients and caregivers show support for lung cancer research and development. As many of you know, lung cancer is not as highly funded by the federal government as many other cancers, and as a result, depends on nonprofit and other private sources of funding. Speaking of the federal government, some advocates participate in political advocacy, where they work to increase the funds that the federal government allocates to lung cancer research. Political advocates may visit DC, storm the Hill, and participate in other lobbying efforts. Go-To Foundation holds an annual Lung Cancer Voices Summit that focuses on this type of advocacy. Locally, there are often other opportunities to participate in government efforts, local efforts, to improve laws for topics such as biomarker testing in many states. Last but not least is research advocacy, my area, my main area, where advocates work with scientists, researcher oncologists, pharmaceutical companies, and industry members in order to share the patient perspective and make sure research meets patient needs. One role of research advocates is to act as a liaison between the patient community and scientists. We inform and educate the patient community about developments in clinical trials. Often, what this means is that we take a very scientific topic and try to help describe it in more easily understandable lay language so that it's more accessible to people without scientific backgrounds. If you've ever spent time on clinicaltrials.gov looking for a clinical trial or attempting to read an article from a medical journal, you know how difficult the language used can be and how difficult some of that structure can be. So advocates really do a lot in order to improve and make it possible for people without a medical background to understand these things. Advocates do things like reviewing clinical trial protocols and informed consent documents to make them more understandable and patient friendly as well. In order for researchers to get the funds for their research, they typically need to apply for grant programs. These grants can be from the government or from private funders. Advocates help evaluate these grant applications to see if they actually will have a significant impact on patients and are deserving of being funded. We want projects to be funded that will help us move forward with understanding and treatment of lung cancer, not just interesting science. In fact, many organizations that give grants are now mandating that patients be involved in this type of review process. Some research advocates participate in various regulatory bodies, such as institutional review boards and data safety monitoring boards, to make sure that patient rights are not being compromised for the sake of research. Others share patient perspectives on research through participating in cooperative groups, SPORs, and pharmaceutical advisory boards. Cooperative groups are supported by the NCI and are made up of researchers, cancer centers, and advocates working together to develop clinical trials. There are currently 4 cooperative groups in the United States that deal with adult oncology. NCI-funded SPORs are cancer center specific, academic cancer centers, and bring together multidisciplinary experts within that center to collaborate on research projects. SPOR stands for Specialized Program of Research Excellence. Advocates working with these type of groups can often share patient perspectives with large numbers of researchers at one time who are on the cutting edges of research. Last but not least, research advocates can collaborate directly with scientists to develop projects and trials to benefit patients. A number of groups founded in the past 10 years focus on patient directed research in this way, and I'll talk a little bit about this shortly.